Good morning, everyone. Thank you for being here. All set? My name is Mike Caligiuri from Ohio State University. I have the pleasure of chairing the National Cancer Policy Forum. And I want to first and foremost wish everybody a good morning. Thank you for making the trip in, either this morning as I did, getting up at 4 a.m., or those of you that came in last night. We know this is going to be well worth it. A couple housekeeping things. I think your computer should locate the wireless, and it's just press one button and you're in. There are no passwords that we know of. Generally, the way things run is when you have a question after each presentation, hold your questions until the presentations are done. When the presentations are done, there's time for questions, and we'd like you to go up to the microphones, which you can see at either end of the room here. We just ask that when you speak into the microphone, we have someone on the phone calling in from Europe, and that you identify your name and your institution. That's very important for recording minutes as to who's saying what, and we very much appreciate that. We have a number of new members. What has been traditionally done is we have our meeting on Sunday night, and then we have these exciting presentations on Monday and sometimes Tuesday. But now we've switched things around, and our forum discussion is going to be tomorrow, and today we have an exciting presentation that you'll hear about shortly. So first thing I wanted to do is to welcome the new forum members. We're not going to identify you by name, rank, and serial number today, but that'll be done tomorrow. But just to let you know that the National Cancer Policy Forum is here, appointed by the Institute of Medicine, and it's here to serve as a focal point and a trusted venue for the engagement of you, national leaders from multiple sectors, and working cooperatively to address the high priority issues in the nation's effort to combat cancer. The IOM draws upon its uniquely independent status and the expertise that we have here to steward sustained discussion and collaboration among national experts and health stakeholders on issues relevant to the goals of preventing and treating cancer. And our participants, all here now, represent our clinicians, patients, researchers, professionals and advocacy organizations, pharmaceutical manufacturers, and policymakers. The two objectives of the forum are first to identify the emerging high-priority issues in science, clinical medicine, and public health that are relevant to the goals of preventing and treating cancer, and second, to examine those issues through convening activities that promote discussion and potential opportunities for action. And so, as I said, today we're going to start with one of those exciting activities, and that is our meeting on the workshop of ensuing patient access to cancer drugs. We're going to have a very, very exciting day, and it's going to be led by Dr. Peter Bach from Memorial Sloan Kettering. So, Peter, you want to come up and get the ball rolling? Thank you very much.